I think the first thing you have to do is you have to ask yourself, how invested are you in neoadjuvant hormonal therapy? And I think in America we're not. I think generally our colleagues in Europe are a little bit ahead of us there. But on the other hand, I think the recognition that luminal A disease generally doesn't respond that well to chemotherapy has got everybody to realize that. I think if someone does come in with luminal A disease with a big tumor that you want to shrink for whatever reason, that neoadjuvant hormonal therapy is probably the way to go. Given that, I think, and given the increased response rates that we are seeing in measurable disease, in metastatic disease, with CDK4/6 inhibitors and the various aromatase inhibitors and other drugs as well, I suspect that using neoadjuvant CDK4/6 with neoadjuvant antihormonal therapy is definitely going to be in our future as a way to kind of shrink tumors down even further, especially those that are luminal A, maybe kind of lowish luminal B. I think those are the patients that will likely get this combination. There's several trials of it going on right now. The current trials that have been done so far have not really, they've looked at efficacy as kind of an endpoint. They're more kind of looking at cell cycle arrest, lowering Ki-67 to certain levels. That's really the primary endpoint of those trials. So they're not really truly response trials. But I think that there are some response trials out there that could guide us in whether these should be used or not.